Good afternoon. I'd like to thank Dr. Chris for coming all the way down, a proud U of A Medical School alumnus. Thank you for being here. I understand we have you a visor, so we want you to wear it proudly. General McGuire, our good friend Juan Ciscomani, for being here with us today, for their trust in us at the U of A to run this pod for the state, and for Governor Ducey's partnership, not only for this state-run vaccination pod, but with all the support you gave us for antibody testing and all that we've been doing. We're very excited about the expansion of the vaccination pod here at the University of Arizona, and we're proud to serve the people of Southern Arizona. Serving Pima County educators through our partnership with the Pima County Health Department has been very successful. That's where we started in this pod. We have a very strong relationship with Dr. Teresa Cullen, Dr. Francisco Garcia, and Mr. Chuck Huckleberry, and that is a very strong relationship that has worked well and will continue to work well in the future. We're also very close to Mayor Romero, the City Council, and all three entities work very well in lockstep here in Pima County. This expansion builds on our success, bringing new vaccination capacity to Southern Arizona in a continued partnership with the county and now the state. We will add additional shifts with the possibility of moving to a 24/7 high throughput distribution of up to 6,000 to 8,000 doses per day at this site. The doses we administer here at the University Pod will now be in addition to, incrementally, to the already allocated vaccines that are given to Pima County, enabling the residents of Southern Arizona to be vaccinated more quickly. And that's what we're after. Try to vaccinate as many people as we possibly can as fast as we can, because the faster we do that, the less chance the virus has to mutate. We're in the position to perform this service thanks to several outstanding leaders on our campus. I don't know where Chris Kopak is. He's around here somewhere, but there you are. Chris, thank you so much for you, who leads our incident command system here. He's the commander of our incident command system at the university. And Mona Aurora, I don't know if Mona, I think I see you back there, Mona, who's a faculty member in the Mel and Enid Zuckerman College of Public Health and co-chair of the university's vaccine task force. And Lane Spalla. Is Lane here? He's not here. Don't see him. But Lane, who is our emergency management coordinator with the University of Arizona Police Department and co-chair of the vaccine task force with Mona. Registration opened for the state pod earlier this week through the Arizona Department of Health Services. Providing this service is a fundamental part of the University of Arizona land grant mission to our state and our community. We are so thankful that we have the state registration system that's working so well, and it's been a transition from the county registration system to the state has worked flawlessly. We're committed to helping and ensuring as many Arizonans as possible are vaccinated as quickly and safely as possible, with a continued absolute commitment to equity. To making sure that our most vulnerable populations get access to this vaccine as soon as possible and as early as possible. With that, I will turn it over to you, Dr. Chris. Thank you for being here. Thank you all for being here.
Yes. Thank you. Good afternoon. It's such a pleasure to be back at the University of Arizona, where this is my medical school alma mater, and to celebrate on this collaboration. So thank you, Dr. Robbins, and our partners at Pima County Health Department and everyone else who has partnered on this vaccination site. The state sites at State Farm Stadium and Phoenix Municipal Stadium have helped greatly increase the administration of COVID-19 vaccine in Arizona. These sites have been built off the best practices that we have witnessed of the existing vaccination sites run by Dignity Health, Honor Health, Tucson Medical Center, Banner Health, and other facilities around the state. And now we are thrilled to work with our partners to position Southern Arizona to rapidly expand vaccine distribution as our federal supply grows. The University of Arizona's vaccination site has a proven record of success. This partnership is expanding the capacity and hours of operation, and it will eventually allow for a 24/7 operation that can serve up to 6,000 people per day. Our state has seen a decline in the COVID-19 cases of late as Arizonans have followed mitigation strategies required to reduce the spread. And we just want to thank everyone for their hard work, and we urge everyone to keep it up. There's still a long way to go in our battle against COVID-19. Being able to ramp up operations at this site as more vaccine becomes available will provide another weapon against COVID-19. And it complements Pima County's strong vaccination efforts to date. To date, over 1.3 million doses of COVID-19 vaccine have been administered to over 1 million Arizonans, and that includes 332,000 of them who have received both doses. When your place in line arrives, we urge you to get vaccinated. These vaccines are the light at the end of the tunnel, and vaccines are one of the most effective public health tools we have for controlling diseases, whether it be influenza, measles, or whooping cough. Because it's still going to be a matter of months before this vaccine is available to all, we must continue doing all that we can to prevent the spread of COVID-19 and taking precautions whenever you are around people that you don't live with. This includes wearing a mask over your nose and mouth, maintaining at least 6 feet of physical distance, washing your hands or hand sanitizing often, making sure that you stay home if you feel sick, and avoiding crowds. Arizonans have been doing a phenomenal job of that over the last month. Again, I want to thank Dr. Robbins and the entire team who has made this partnership a reality for the people of Southern Arizona, and we are so excited to be here for this launch. I'm now going to hand it over to Major General Mick McGuire.
Good afternoon, everybody. Dr. Robbins, thanks for having us down. Dr. Chris, Mr. Ciscomani, great to be here with you today. I just want to say to all of you, this is the third venture that our agency has partnered with Dr. Chris and her agency to expand, in this case, a state pod. And to Dr. Robbins and Chris, you guys have just done a great job. This is a very well-oiled machine, has unique capabilities to allow ambulatory and folks that can walk in that may not be in a car to be able to get vaccines. Is something that we haven't been able to do at our other sites up in Maricopa County. I'm excited about the decision we've made to keep this in a Pfizer setup, have great cold chain storage, and partnership with the University of Arizona Pharmacy, which is a key to making all of these pods successful. Our role here is really to expand hours of operations beyond 6 hours, to make a call for volunteers, to triage any gaps in the coverage for 24 hours with our National Guardsmen and other incident management folks, and get this thing up and running 24 hours so that as many of those most at risk here in Pima County can receive the vaccine. Couldn't be prouder of the partnership. Certainly learned a lot from our time here, and I know we're going to be able to take this same model and export it next to Yuma County and then to Coconino County over the next couple of weeks as we continue to drive towards that 3.5 million of our fellow adult citizens getting vaccinated. So thank you very much. It's always great to be home back in Pima County, and I'm glad to be back. Thank you.
Thank you for that, Brandon. Hello, everyone. My name is Juan Ciscomani. I'm Governor Ducey's Senior Advisor for Regional and International Affairs. Thank you very much for hosting us, Dr. Robbins, General McGuire. Always good to be next to you. And Dr. Chris, thank you for all the work that you do. I will be summarizing what our three leaders up here have said, but I'm going to be doing that in Spanish for our Spanish-speaking audience. So I will transition to Spanish now. Gracias y buenas tardes a todos. Es un placer estar con ustedes a nombre del gobernador Doug Ducey para celebrar este logro en la lucha contra el COVID-19. Primero y ante todo me gustaría agradecer y reconocer a muchos que han sido fundamentales los últimos 12 meses y esenciales para nuestros sitios de vacunación a través de Arizona y en especial aquí en Tucson. El personal de primeros auxilios, gracias por su liderazgo, gracias por estar siempre al frente de la batalla, gracias por poner todo en la línea al protegernos al resto de nosotros. Dr. Kara Christ, agradecemos sus incansables esfuerzos y los de su equipo para proteger a nuestros seres queridos. General McGuire y miembros de la Guardia Nacional, gracias por asegurar que nuestros centros de vacunación funcionen con precisión a grado militar. Y Dr. Robbins, siempre es bueno estar aquí en su campus y poder agradecerles especialmente por la colaboración por este sitio fundamental para nuestra comunidad. Este sitio de vacunación es un logro importante que no hubiera sido posible sin su equipo y sin usted. Ahora, con respecto a la aplicación del acceso y las vacunas, la demanda para la vacuna sigue alta y el gobernador Doug Ducey continúa abogando firmemente para que Arizona reciba aumentos en la asignación de dosis por nuestros contrapartes del gobierno federal. Estamos encantados de trabajar con nuestros socios en el sur de Arizona para expandir rápidamente la distribución de las vacunas, con medida y aumenta la oferta. La expansión de este sitio de vacunación es un paso crucial en la lucha contra el COVID-19 y este sitio por sí solo puede atender hasta 6,000 personas por día a plena capacidad. Me complace compartir que Arizona ahora se encuentra entre los 10 estados principales que han administrado el mayor número de dosis a frecuencia diaria según el rastreador de vacunas de Bloomberg. Y me complace compartir que Arizona también está dirigiendo y liderando en otras áreas. Hasta la fecha, más de 1 millón de arizonenses han recibido la vacuna y ahora se han administrado, el día de hoy, más de 1.3 millones de dosis. Agradecemos a todos los que han puesto su mayor empeño por hacer su parte y esto posible. Un llamado para finalizar a mantener la vigilancia. Cada uno de nosotros ha sido llamados a proteger a nuestros seres queridos y a los que están más cerca de nosotros. Es importante recordar que esta vacuna es solo una parte de la solución. Debemos seguir tomando las precauciones que cada vez que estemos cerca de personas que son miembros de nuestro hogar. Uso de las mascarillas y cubreboca. Mantengamos la distancia de 6 pies. Lavarnos y desinfectar las manos. Quedarnos en casa si nos sentimos mal y evitar las multitudes. Gracias nuevamente a todos los que han hecho esta asociación posible. Como orgulloso Wildcat y graduado de la Universidad de Arizona, me complace ver que la Universidad de Arizona lidere una vez más en la responsabilidad de servir a nuestra comunidad donde más importa. Gracias y mantengámonos a salvo.
That concludes the official remarks portion of today's press briefing. If you are interested in asking a question, we ask that you please line up behind this microphone right here, and then you can ask your questions. Just please try to maintain a safe social distancing spacing as you step up to the mic. And with that, and please make sure you introduce yourself and your news organization. Thanks.
Is it on? There you go. Hey, Josh Sanders with KPNX 12 News in Phoenix. Dr. Chris, thank you guys for being here. Dr. Chris, questions for you. We're hearing of some rural counties right now that have been impacted by the issues when it comes to the Moderna vaccine. Even here in Pima County officials have said, hey, 2,800 may be impacted. What conversations have you had with Pima County, Coconino County, who have had to cancel or postpone 1,500 or 1,800 cases? What do those conversations look like right now?
Yeah, so we are keeping in touch with our federal partners as well as our county partners. We know that there are shipping delays due to weather, that the entire country is being impacted. It sounds like our Pfizer doses got shipped out and should be arriving. The Moderna doses have still not shipped out just yet. So we're trying to maintain situational awareness and identify where potentially doses can be reallocated so that we don't have to cancel appointments, or where appointments can be rescheduled so that people don't miss those doses.
Weather is fluid, obviously. Do you have any expectation, though, from the federal government of when those Moderna vaccines will get here into the state?
What we're anticipating right now, given, but I can't predict the weather, would be that they probably will arrive at the beginning of next week, because we've heard that they will not ship on the weekends, and so it will likely be next week before we get those doses.
And the word equity was mentioned. What are the conversations you're having going forward, especially when it comes to Southern Arizona, this being the largest pod site now to serve Southern Arizona, when it comes to this site and equity? Can you expand on that?
Sure. So we continue to work with community partners to identify, those communities that are hard to reach, maybe vaccine hesitant, or we know that they have high risk comorbidities and want to make sure that they get vaccinated, to tailor the communication and our upcoming campaign so that the messages resonate, are culturally sensitive, and that we're getting vaccine into those populations. So that's one of the nice things about this site, is that it is centrally located, but we will be looking at moving to community-based pods as we get more vaccine in the state.
And there was mention of future state-run pods in Yuma or Yavapai. Is there a timeline of when we can expect to see pods open up in those rural counties?
So we don't have exact dates yet, but we are working with our partners to establish those pods in the next couple of weeks.
Thank you.
Welcome.
Dr. Chris, this was for you, Greg Bradbury from KGUN. And my question is, so right now you said you were hopefully going to get to 6,000 vaccines a day, 24 hours a day. But what are the numbers like right now here at this state pod, and how will that gradually expand?
So it will depend on the vaccine supply that we're receiving from our federal partners. Right now, I believe that you guys are running between 600 and 1,200 during the day. As we add more hours, we look to add a certain number per hour depending on our vaccine supply. So that's very different. If you look at how State Farm, we do about 400 an hour, but at Phoenix Municipal, we initially planned to do 500 a day. So we totally base it on the number of doses that we get.
And then in terms of vaccine phases, do you know when we can expect the next phase to be allowed to get the vaccine?
So what we're looking at is potentially, some of our counties have already advanced into phase 1B, which includes those with, I'm sorry, all of a sudden I'm blanking. It will include those that have chronic medical conditions. No, that's 1C. Why can't I think of? Yes, essential workers. I'm sorry. I knew it was a big group. So as we move into all of phase 1B, it will have the essential workers that will expand the population that's available. We're looking at the beginning to mid-March for the state on a general basis to move into phase 1B.
And then following up on the weather, obviously it's unpredictable, but it did postpone some vaccines, not just, really throughout Arizona. In terms of this vaccination site, were there any issues with that?
So with this is the Pfizer vaccine. We do have ample supplies to be able to reallocate the Pfizer vaccine, so it's not impacting any of the state or county-run large pods.
Perfect. Thank you.
Yeah, absolutely.
For Dr. Chris, sorry. I'm Daniel McFarland with KVOA, and earlier today the Pima County Administrator announced that they were going to be halting COVID testing because of funding. What is your response to that?
So we're working very closely with our counties to get funding for additional testing. So hopefully they got some updated messaging tonight. We do have federal funding that has come to the state. We're working on the budget, but we're looking to get a portion of that out very, very quickly because we know how important testing is.
So do you think that this will be able to get done before they hold a vote on Monday?
They should have notice because we are just being able to amend contracts and those types of things. It'll depend on what their plan is and what they want to submit as their testing plan. But Pima County has had a phenomenal testing strategy, and so we know that we want to keep that going. So hopefully we'll be able to get those contracts amended pretty quickly.
Perfect. Thank you for your time.
You're welcome. Thank you. Just stay here?
Yeah.
Okay.
Hi, I'm Mark Bangura. I'm also from KVOA. As this site transitions to the state-run site, will they still be receiving vaccines that are allocated to Pima County as a whole, or will this site be getting a different allocation of vaccines directly from the state?
So it's kind of a combination of both. Right now, while the doses are limited, what we do is we take the allocation based on the population. So Pima County accounts for about 14% of the state's phase 1B population. Because Pima County and Maricopa County are really the entities that can handle the Pfizer, we allocate the Pfizer doses. Many of our main large pods are utilizing the Pfizer doses. And then based on that, we figure out what the remaining doses are so that we can allocate the Moderna, and we base that to the rest of the counties as well.
And so as they ramp up here to get close to that 6,000 mark, will that, I know we're waiting on more vaccines and that's a national shortage, but in the short term, if they're able to ramp up quickly here, will they then start getting more of that before we have supply like we would hope?
So what would happen is, like, we anticipate getting level supply for the next couple of weeks. So what we would likely do is keep the number of doses here so that we can make sure that we're meeting all of the appointments that have already been scheduled. Then after a couple of weeks, as we anticipate getting more and more vaccine, then we would increase the supplies pro rata.
And then, so I guess final question would be, if they say they get up to 4,000, per day by, 2 weeks from now, would you be making sure that they have 4,000 vaccines here, even if we don't have more for the county as a whole?
So likely what we would do is we would just keep the appointments about the same as they're doing right now. We would take a look, but we wouldn't be pulling additional vaccine. It would be staying relatively stable until we got more, and then we would relook at the allocation. And then as we get more, hopefully then it wouldn't impact the counties quite as much.
All right, thank you very much.
You're welcome. Is this for me? Okay.
Hi, I'm Jasmine Demers with the Arizona Daily Star. So I wanted to ask a little bit more about the disadvantaged groups in Pima County specifically. So a lot of people are quite concerned that another sort of big pop-up site in the state will, not pop-up site, but pod in the state will sort of prevent allocations going towards those smaller community partners and those mobile sites that Pima County has been trying to put out there for those disadvantaged groups throughout our county. And I'm just wondering, from your perspective, what is the state stance on that, and what can you tell those people that are concerned about it?
Yeah, absolutely. So that is a great question, and it's something that we continuously work on. So the main vaccine pods that are state operated, we were really glad that we were able to keep this pod with the Pfizer vaccine, because it has such strict handling requirements that it's much easier at these mass distribution centers. And what that does is it saves the Moderna vaccine for those mobile clinics, for those community-based pods, because the storage requirements aren't that stringent. And so with being able to keep it Pfizer, that's going to keep more Moderna available for the communities. As we move and get more vaccine, you will start to see them in pharmacies, so Walgreens, CVS, Fry's, Albertsons, Safeway. What the federal partners have done is they have worked with the state to identify pharmacies that are in harder to reach populations or impacted communities so that they could go to the pharmacy to get it. And we continue to try and make sure that vaccine is going to our community health centers and providers that are trusted voices in those communities so that they can continue to vaccinate those populations. And those efforts are just going to continue to increase as we get more vaccine.
Definitely. And do you happen to know how many vaccines the U of A is going to receive next week?
I don't know that off the top of my head, but we can get that for you.
Thank you. And then one more question. There was talks in Pima County for a while, and it continues to set up a 24/7 site at Rieto Park. And so some people are concerned that maybe this site is a little bit too small for the effort, and that we want to really ramp up. Is there any consideration that the Rieto site would also be set up at the same time, or would would this site potentially move to the Rieto site eventually?
So I think all of those are possibilities. You know, we are open to multiple partners and multiple sites as we get more vaccines. So for example, State Farm Stadium is a 24/7 operation right now. Phoenix Muni has the ability to go 24/7, but given the limited number of doses, they operate 7 to 5. And so the same thing would likely happen here. As we ramped up and got this up to a 24/7, we're always looking for additional sites that potentially could serve as vaccination sites and willing partners who want to partner with the state and the county to operate those sites. And so that still is a potential possibility.
Gotcha. Thank you.
Welcome.
Hi, I'm Silvia with Univision. My question is for Siscomani. And it's going to be in Spanish. Sabemos que las comunidades latinas, hispanas, son las que están siendo más afectadas por el coronavirus. ¿Qué está haciendo el Estado? Hemos recibido quejas que hay en lugares en donde no hay personas que hablen español. ¿Qué es lo que está haciendo el Estado para que haya más recursos en español para estas comunidades?
Definitivamente la comunidad hispana en español es una prioridad para la administración y para el equipo de DHS también y para la universidad. Estamos haciendo varios esfuerzos para alcanzar a nuestra comunidad en el idioma preferido muchas veces, que es el español. La página entera está traducida al español, la página de internet. Sabemos que no todas las personas tienen acceso a internet, entonces también los operadores por teléfono también pueden hablar español y de incluso muchos de los voluntarios y personal que ves aquí en esta localidad y en las de Phoenix también hay personal en español. Definitivamente es una prioridad para nosotros, como te digo, el poder traer estos servicios a nuestra comunidad en español, en el idioma que lo puedan entender y recibir, al igual que el mensaje de la importancia de vacunarse. Y por eso es que estamos haciendo esos esfuerzos proactivos, saliendo en la radio, tratando de dar anuncios, por medio de noticieros como los de ustedes, para expandir la palabra y la voz, para que la gente pueda saber que pueden venir a vacunarse, que hay servicios en español, que pueden hacer su cita en español también por internet o por teléfono, y que es un proceso seguro y fácil de seguir.
¿Qué puede hacer alguien si llega a un lugar como el de aquí y no hay alguien que hable español? Porque ya nos han hablado al respecto. ¿Qué solución hay para ellos?
Pues esperemos que eso no llegue a pasar, y si llega a pasar les pido una disculpa de antemano por ello, por lo que ha de haber pasado. Sin embargo, estamos haciendo todo el esfuerzo posible para siempre tener a alguien en español que pueda responder las preguntas y verdaderamente dar un buen servicio al cliente a toda nuestra comunidad en el idioma que lo necesiten.
Gracias.
Gracias.
Is there any chance we could get that in English as well? Because I'm curious. Sorry. Thank you so much.
So the question was regarding services in Spanish and the importance of that and what the state is doing to serve our Spanish-speaking population. So what I was explaining to Silvia was that our entire website is translated in Spanish. We've had every press release since the very beginning of this also translated into Spanish. And not only is the information in Spanish available online, but also we have volunteers and staff that can be that are operators for the phone services. A lot of these sites as well, and most of the time, we have personnel and volunteers that can help people in Spanish. So just reiterating that we hold the Spanish-speaking community at a high importance level, and that we've been focusing and leading on providing all the services that we do in English, also in Spanish. That's been a priority for Governor Ducey and Dr. Christ, and it is here for Dr. Robbins. So we're and if you have any more questions on that, or you run into any kind of example you would like us to know about, we're happy to listen and make the improvements that we need to.
A possible follow-up for Mr. Siscomani. Lorraine from Arizona Public Media.
Hi, Lorraine.
Is the state prepared to potentially vaccinate or test individuals who may be coming to the border under the Biden administration's request that if people need to, they can come and request asylum?
Well, thank you for that question. I think Dr. Chris is better suited than me to answer that, so I'm going to turn the microphone over to her after Brandon wipes down the...
So currently, we work with our border counties to make sure that they can account for some of those migratory populations as well as the residents living in there. Arizona does not have a residency requirement to be eligible for the vaccine. So anybody who comes up to a vaccination site can get vaccinated for COVID-19.
Okay, and then if you could clarify the 20,000 that are listed here on this banner, are those all university employees or throughout Pima County who have come through this site? And if you could, can you clarify if contract workers at the University of Arizona have had access to the vaccines as well?
So the 20,000 that have been delivered at this site so far have been a combination. I think, Chris, and I'll look to you, but I think it's about a third of that 20,000 would have been allocated for U of A faculty or staff. And the rest was for the community. We were given the charge by the county to vaccinate daycare workers, K-12 educators, Pima Community College faculty and staff, and the U of A faculty and staff.
Are contract workers under that umbrella as well?
I don't know that we have any contract workers, Chris. Do we? Is it mostly been our volunteers and employees at the university?
Okay, thank you for clarifying.
Thank you.
Okay, well, thank you all for joining us. That concludes today's press briefing. We want to thank you for coming out and joining us today. You can exit the same way you came in, just through the back, and we're going to take these guys on a tour of the pod. So thank you for coming. Appreciate it.